student advisor here with the Internationalization Office at Memorial University. My pronouns are she and her, and I'd like to recognize that I'm an uninvited settler here in the ancestral homelands of the Beothuk and the Mi'kmaq. And thanks so much for joining, and for Hareem as well for organizing these groups of sessions for you this week as new incoming international students in the winter 2025 semester. So we've been covering different topics throughout the week, and today's topic is about health insurance. Before we begin, I just want to provide a land acknowledgement, something perhaps you've heard at the start of many of our sessions, but that is that we'd like to acknowledge the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respects the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We encourage everyone to reflect on the lands where you're located and the Indigenous people for whom these lands are traditional territory. So we provide a land acknowledgement as a way to place ourselves in terms of our relationship with the land. And that is something that traditionally has been done and continues to be done by Indigenous populations in Canada. But certainly as a colonial institution like Memorial University, that is based on colonial values and was founded and continues to be run by primarily settlers here in Canada. We do it as a way to recognize our our place in bringing truth to Memorial's role here and hoping to reconcile with Indigenous peoples. And the reasons why this is important and has become important as of late in Canadian history is because of research that has been done and work that's being done by the government for Canada to reconcile with its Indigenous peoples. And it's interesting because it's not anything in terms that I grew up knowing in the Canadian education system. So there's a lot that needs to be done, I think, to educate folks about the dark history, really, of Canada's past when it comes to settlers coming over and basically taking many lands that were unceded from Indigenous people, right, who often welcomed these settlers and engaged in a lot of trading practices with them, but ultimately suffered and continue to suffer racial discrimination to this day. So if, as part of your journey here in Canada, you're wanting to learn more about Canadian history or particularly the Indigenous peoples of Canada, there's certainly a lot of resources and things out there for you to engage with. So before we begin, I just want to say that we will have lots of time at the end of the presentation for questions. So please hold your questions until that time. I'm really hoping that throughout the presentation, we're going to answer pretty much most of your questions, okay? And I think when it is time for questions, we'll likely use the chat function here in WebEx. All right. So this session is entirely about health insurance. So by listening to this session, we hope that you'll be able to describe the difference between the different types of health insurance that we're going to talk about and introduce. And that's the Foreign Health MCP and the Student Union Managed Health Insurance. You'll also be able to describe what might make you eligible to opt out of the foreign health, which is the mandatory insurance you'll get automatically as a student. Be able to describe to us about how to do that opt out and tell me what the deadline is to opt out for our winter 2025 semester. And then we're going to get into more than just kind of about the opt-out, is about the insurer of the foreign health, which is GuardMe, and what kind of services are available to you as a student who's going to be insured by this insurance company. And then when you are here in Canada, if you feel unwell, how does the Canadian healthcare system work and how would you be able to seek medical care? Okay. So very basically, health insurance is something that you pay for to help cover the cost to seek medical care. Because anytime you visit a doctor, if you have to get an x-ray, if you make a visit to the emergency room, if you had to get blood work, there are costs associated with all of these things. If you had to get prescription medication filled from a pharmacy, if you wanted to seek like paramedical services like massage therapy, get an eye test from an optometrist, get a dental cleaning or checkup, right? All of these things cost money, and healthcare in Canada is actually incredibly expensive. So without health insurance, it's not affordable for most people, right? But your health is so important, and it's really important that it's taken care of. And you don't want the impediment of the cost of having to seek health care preventing you from seeking the necessary care that you need. So this is why we have health insurance, where we pay a fee into a health insurance plan, which then helps to pay out to the medical provider if you need to cover the cost and make that claim. Okay, so that's what health insurance is in general, and that's why it's so important, because it is it's so expensive to seek health care in Canada. But it's also can be very complicated, right? Because there's different types of health insurance, and no health insurance is going to cover 100% of everything all the time, right? And the different health insurance plans will then cover different things, right? So people will have different plans that will cover some things that won't cover others. All right. So as a way to try to, I hope, make it more manageable information, we're going to break it down, and we're going to talk about three types of health insurance that you, as an international student coming to Memorial, may be able to avail of, and some that you have to have. Okay, so we're going to talk about the foreign health insurance, which is provided by a company called GuardMe. And that is the health insurance plan that we administer here at the Internationalization office, and is part of my job as an international student advisor. Second, we're going to talk about the Medical Care Plan, or MCP, which comes from the government of Newfoundland and Labrador. So it's not affiliated with the university, but is wonderful coverage. And we encourage new students, if they're eligible, to get MCP. And we help to promote that through different clinics. When you come, you might be able to meet with a representative from MCP on campus. And third is a student union health and dental plan. So our student unions at the university, they also manage a health and dental plan with a company called Green Shield. And that health and dental plan is what our Canadian students, for example, get automatically. And so and you might be able to get too. So we'll talk about that. So first of all, let's go into the foreign health insurance with GuardMe. So foreign health is basically the line item that you will see in your student account when you look at your financial tab. So once you register for your courses, if you were to go look at your financial charges, you'll see a charge there for foreign health. So that's why we call it that. That's what you'll see in your charges. The provider of the foreign health insurance would be a company, and that can change over time, although GuardMe has been the provider of the foreign health at Memorial for over 20 years. Okay, so foreign health insurance is mandatory, which means that it is required that all registered international students have this health insurance. And the way we make it mandatory is that it's tied to your registration. So if you've registered, or once you get registered for your courses or for your program, you start to be charged your tuition and your student services and other ancillary fees. And one of the fees you'll see there is the foreign health. So once you register, you're automatically charged that foreign health fee. As I mentioned, we manage that insurance, okay, at the Internationalization office. The current provider of that insurance is GuardMe, and the insurance is charged on a semester basis, and it's only charged to you if you are a registered student, okay? And the way that the coverage will go is it will align with kind of the semester dates. So if you're a registered student in the winter 2025 semester, you'll see a charge on your student account for $261.59, and that will cover you from January 1st to April 30th. If you are registered for the spring, you'll pay another $261.59, and that will cover you from May 1st to August 31st. So there's no gap in your coverage. But if you're not registered in the spring, particularly if you're an undergraduate student. That semester may be an optional semester for you, and you may choose not to take courses. You're not charged or you're not covered. Okay. Now you can opt in to get insurance when you have a gap in your studies, and I would certainly recommend you do that if you're in Canada. So it's only automatic if you're registered, and if you maintain continuous registration, there's no gaps in your coverage, but the coverage dates do align with the months of that semester. Okay. And as I mentioned, the rate is currently $261.59. It's certainly subject to change, and this is the rate, at least for the winter 2025 and spring 2025 semester. There could be a change in fall 2025. Okay. So what does the health insurance from GuardMe, what does it cover? So I describe it as a comprehensive emergency medical insurance. So we break down those words. Comprehensive. What I mean by that is it covers your various stages of healthcare. So if you're not feeling well, the first thing you might do is to book appointment to see a physician, to talk to them about your symptoms. So there is the cost of that visit. That physician may evaluate your symptoms and prescribe you a medication. You'll take that prescription and you'll go to the pharmacy to get that filled. That's a second kind of stage, in your healthcare. So it covers those different stages of healthcare. So it covers the doctor's visit, for example. It will also cover the prescription medication. But it only covers those in an emergent situation. Okay, that's the emergency part of it. Now, emergency is not necessarily that it has to be so bad that it brings you to the emergency room. It's just to say that this insurance is primarily meant for emergent conditions, so new conditions that have come up, not conditions you've had in the past, whereby you require like immediate relief of pain or suffering, right? So there has to be that need for relief of some kind of pain, some kind of symptoms for you to seek medical care for it to be covered by this insurance. It wouldn't cover most kind of preventative, or if you just wanted to kind of have a chat with your physician about something, but you didn't necessarily have symptoms that you needed to kind of take care of. Okay. So obviously it's going to cover also those real true emergencies if you break a bone and end up in the emergency room, but it would also cover you if you felt you had an infection, right? Like a cough that just wouldn't go away. Perhaps there was an infection there whereby you might need antibiotics or antiviral medication or something like that. Okay. That does classify kind of into the emergent part. The third part of this definition is medical. Okay. And medical really, when we talk about insurance, there's often a distinction between health insurance and dental insurance. So health insurance generally would cover like a medical doctor, as well as some like paramedical services like optometry or physiotherapy. But your health insurance generally doesn't cover any dental care. That's typically a separate insurance. So this foreign health is primarily a health or medical insurance. It wouldn't cover dental cleanings or checkups. One, because they're often elective and preventative. There is some coverage, however, if it's a dental emergency, like extreme dental pain or necessary tooth extraction. Okay. Um, this insurance, so as you can see, it's in case you need it. It primarily has coverage if something is new or emergent that's kind of coming up. So it often doesn't cover if you have like a pre-existing condition before coming to Canada. Or a chronic condition, right, that might develop over time, and maybe you need healthcare to kind of look at those things. So for the most part, it wouldn't cover those. However, if that pre-existing condition or chronic condition you had required you to take medication that was medically necessary, there could be this up to $10,000 covered for kind of non-emergent but medically necessary services. Okay. And even though it is primarily for new, conditions and in case you need it, there are benefits in that plan that like would cover kind of non-emergencies. So for example, it does cover the cost to see an eye doctor up to $120 every 2 years. It also would cover one annual physical exam. So if you didn't have a reason, but you just wanted to get checked up, it would cover that as well. So there are some non-emergent benefits in there. Another thing I'll say about the Foreign Health with GuardMe is that it is designed for international students. That is who GuardMe works for, right? They don't sell insurance kind of outside of the schooling system. And, you know, being an international student, of course, you're away from your home, you're often away from, your family and your supports. So there are benefits in the GuardMe plan where if you did become critically ill and ended up being in hospital in Canada, say for a period of 7 days or longer, there is a family transportation benefit whereby the insurance company would pay to have a family member maybe come and fly to Canada to be with you. Okay. There's also another benefit in there called a repatriation or burial benefit. So, if you happen to die in Canada, it would cover the cost to repatriate your remains to your home country. So these are things that, you may not be thinking about because who wants to be thinking about those things as you're hopefully starting this exciting journey, but they are important. And I can certainly tell you in my experience with being in this position for the past 18 years that it has had to happen more times than I would like to say. So you can never plan, right, for these emergencies, but we can try our best to make sure that you have the insurance. The other thing about the Foreign Health with GuardMe is it covers you anywhere in Canada. So even if you travel to other provinces in Canada, you're good. And there is some coverage as well for the Foreign Health through the GuardMe if you happen to be outside of Canada, but they can be limited. So you have to pay attention to that. Okay. So that's a summary about the Foreign Health with GuardMe. It's mandatory, automatically charged to you when you're a registered student, $261.59 a semester, primarily emergency health care, but there are some non-emergent, and if it's medically necessary medication, and some great benefits there, sometimes for travel as well as if really difficult and unfortunate health things happen. Okay. So now we're going to move on to another type of health insurance, which you might be eligible for. And this is called the Medical Care Plan, or MCP. And this comes from the government of Newfoundland and Labrador. So we call this a public health insurance because it's a public service from the government, compared to GuardMe, which is through a private company that you pay for, right? That's a private insurance. This is a public provincial health insurance. So that's one way that it's different from the Foreign Health with GuardMe. Another way, of course, is that there's no cost to it. So MCP is free, and uh, it is not at all affiliated with the university, right? It's not mandatory. Um, and it's also different in terms of what it covers. So we've explained the Foreign Health as kind of that comprehensive emergency medical, so covers different stages of your healthcare. I would classify MCP as kind of your basic healthcare that really is designed to kind of cover one stage of your healthcare, which is visits to a physician, so medical appointments, as well as different services that may be delivered in a hospital setting. So a visit to an emergency room at the hospital, if you were referred to the hospital to undergo certain diagnostic testing, which is generally only delivered in a hospital, like an MRI, a CAT scan, an X-ray, an ultrasound, things like that. Um, and and if you had to be admitted to the hospital, and most, but not all, surgical procedures that might have to be undergone in a hospital. So it covers kind of that line, but it wouldn't cover like prescription medication at a pharmacy, and it wouldn't cover things outside of seeing a physician. So not paramedical and not dental, but it will cover you to see a medical doctor, kind of no matter what the reason. So it doesn't exclude kind of pre-existing conditions. It's not, it can cover you if you wanted to see a doctor to discuss like a preventative kind of treatment or something along those lines. Okay. Um, it's also different, as I said, because it's not mandatory and it's not automatic, right? Most of our international students will be eligible for MCP, but not everybody is. So in order to get MCP, you one, have to be eligible, and two, you have to apply. So even if you're eligible and you never apply, then you're without the MCP coverage. So we strongly, strongly encourage students, if you're eligible, to apply and to do it very soon after arrival here in Newfoundland and Labrador. So we've put it as part of kind of the checklist of things you should do when you arrive, just like opening a bank account, applying for your MCP. And we help to coordinate that through our MCP clinics, which Hareem helps to organize, and they'll happen a couple of days in January, and the schedule's on our website. So you can come to the office with all your documentation and apply for your MCP. So to be eligible, you have to be a full-time student, okay? You also need to have a valid study permit for at least a year. So if you're still outside of Canada, you don't know yet if your study permit is going to be issued for at least a year, because your study permit is not issued till you come into Canada and present yourself at the port of entry. Now, most students, if you're in a program that's at least a year, and most of our programs are like that, you're going to have a study permit for at least a year. But if your passport happened to expire beforehand, it may not happen, right? It is ultimately up to the government of Canada and the border officer when you're coming through how long of a study permit you're going to get. So you have to be a full-time student, you have to have a valid study permit for at least a year, and you have to be a resident of Newfoundland and Labrador, which means basically that you intend to reside in this province for the majority of the year, so more than 6 months. Okay. If you are eligible, then you have to actually make the application. And to apply, there's an application form. It's a one-page form, and you have to show proof of your eligibility. And the first thing is to show the proof that you're a full-time student. So this is proof of enrollment. And this would have to be a letter or an email from Memorial University that confirms your enrollment that was issued within the last 30 days of applying for MCP. And you also have to provide a photocopy of your study permit to show the length of that study permit to make sure you're eligible. And you also have to provide a copy of your passport. All right. So if you, as the main applicant, the student, is eligible and you have dependents, so a spouse or dependent children accompanying you, if you're eligible for MCP and each of your dependents has an immigration document, whether it's a visitor record or work permit, valid for at least a year, you can include them on your application, and everybody in the family could obtain the MCP. So it is really, really wonderful coverage to have. It's free, so you're highly encouraged to apply and to renew your MCP. Generally, you have to do that every year. And to keep that active. You'll notice, it's just highly accepted. Anytime you go to a doctor, probably the first question they're going to ask you is, show us your MCP, right? And there are people here who don't have MCP, but it just goes to show, how widely accepted it is, because they take that MCP and basically, instead of charging you for the visit to see the doctor or claiming it through a private insurance, they just send a request, like they bill the government of Newfoundland and Labrador, essentially. Okay. Yeah, so that's MCP. However, MCP, even for the people who have it, right, is not really enough insurance. So in Canada, of course, if you're a Canadian citizen or permanent resident here residing in the province of Newfoundland and Labrador, you will have MCP, right? Eligibility is a bit different for those folks. So myself, I have MCP, for example, but it's not enough insurance. I also have what I call supplemental health insurance, and it's can also be called like extended benefits. So the idea is that I pay into a health and dental plan that helps to cover things not covered by MCP. And I do that as part of my employment. So a lot of employers kind of offer that, but also if you're studying, schools will offer that, right? So at Memorial University, our Canadian students will automatically, when they register, see a charge on their student accounts, but that charge comes from their student union. And that the student union is basically a group of students that represents your interests here at Memorial. You actually pay union fees to be a member of that union, and the union is there to help represent your rights as a student, to the university. And they do different advocacy campaigns and they provide different services to support their members. At Memorial, there's actually 4 different student unions, and which one you belong to will depend on 1, your level of study, and then 2, possibly your campus of study. So if you're a graduate student, your student union is a GSU, and that's your union regardless of which campus you are a graduate student on. Okay. If you're an undergraduate student, there's a different student union for St. John's campus called MUNSU, the Marine Institute campus called MISU, and the Grenfell campus called the GCSU, the Grenfell Campus Student Union. Each of those student unions are members of the Canadian Federation of Students, which is the larger organization of student unions across the country at post-secondary institutions. And they have a contract with a company called Green Shield to provide their health and dental benefits. So there is a Green Shield plan for all students through their student union, but the plans are different. So the GSU's health plan is different than the MUNSU's health plan, for example. But the idea with these health and dental plans is that they supplement the MCP coverage. So they cover things like prescription medication, optometry, dentist, chiropractor, that sort of thing. Okay. Now, they'll have 2 separate charges. So there's a health insurance fee and there's a dental insurance fee. If you're a graduate student, you will automatically get the graduate student union dental plan, okay? Because the dental plan kind of stands out on its own. You don't need the MCP to have the GSU dental plan. So as a graduate student, if you were to look at your financial account menu, you would see the foreign health and you'll see the GSU dental, okay? Now, if you get MCP, you may be able to opt out of the foreign health based on having MCP. But what that opt out does is it transfers you to the student union plan, right? So you have MCP and then you have the student union health plan and the dental plan to kind of supplement that coverage. Now, if you get the MCP, you do not have to switch out. It's completely okay to have the MCP along with the foreign health insurance, right? There's lots of things that the foreign health insurance will cover that MCP won't. But you certainly can look at the differences. And if you get MCP, you may be able to switch to the student union plan. It is different coverage, so there's things you have to pay attention to. Firstly, by switching to the student union plan, you may get extra benefits, right? So prescription medication in the student union plan is not limited to medically necessary, right, or emergent situations. So it will cover some preventative medication. So that's a benefit of switching. Another benefit of switching is that the student union plans are usually less expensive than the foreign health, so you save a bit of money. But there are several disadvantages to switching as well. One is that your student union plan is fully based on you maintaining a valid MCP, and MCP is designed to cover you in the province of Newfoundland and Labrador only. If you travel to other provinces or outside of Canada, you might be able to get some out of province coverage, but you have to apply and have that approved, right? So if you're somebody who may be traveling a bit, you might not want to rely solely on the MCP and the student union plan. You may want to stay in the foreign health. The other thing is that the foreign health, as I mentioned, is designed specifically for international students. So it has the repatriation benefit, right? If you were to die in Canada, it would cover the very real expense of having to fly your body back home to be with your loved ones, or the family transportation benefit if you became ill to have your family here. Your student union plans do not have that benefit, right? So if you had that coverage and these things happened, it can be quite expensive on you and your family to cover kind of those expenses as well. So it is really important if you get MCP and you're thinking might want the student union health or dental plan to understand those differences and not just opt out because you heard a friend, right? That was maybe kind of doing it. All right. So I've gotten a little bit ahead to this opt-outs, but we'll get into that. Before we do, I just want to kind of pause and I want us to engage in a little bit of a quiz where I'd like you, once I read the statement out, to just type into the chat if you think this statement is true or false, just to kind of pause and reflect on what it is I have talked about so far, right? Because there's a lot of information here. We just are hoping you have kind of a basic understanding. All right, so let's go. This is quiz 1. So true or false, please type into the chat. Foreign health is optional for registered international students. Is that true or false? It is false. Thank you very much. We can see most people got that right. It is, some people are saying true though. It's not optional, it's mandatory. When you register, you're automatically going to be charged and we're going to enroll you in the Foreign Health with GuardMe. All right. Number 2, is this true or false? Foreign health only covers you in the province of Newfoundland and Labrador, NL. Okay, so this one is false. Again, I'm seeing a bit of kind of some true, some false. So I think it just goes to prove that it is complicated. And I hope I'm not confusing you too much. But the Foreign Health with GuardMe will cover you anywhere in Canada. Okay, it is MCP that only covers you in Newfoundland and Labrador, right? Unless you apply for and are approved for out of province coverage. So it's important to know that. All right, and number 3, you can apply for MCP before you come to Canada. Is this true or false? Okay, and it looks like everybody's getting this one right. Yes, this one is false. So that's because you have to, 1, have a valid study permit for at least a year, right, in order to apply, and that study permit's not issued till you get here. And 2, you have to be a resident of Newfoundland and Labrador. So they want to see that you are living here in this province. All right, so we're going to move on and we're going to be talking about the opting out of the foreign health insurance. So the foreign health insurance with GuardMe is mandatory. You have to have it. But we go through at the beginning of every semester an opt-out period. And the student unions have this too, right? So the student union plans, our Canadian students are charged those automatically as well, but they might be eligible to opt out or cancel the student union plan, just like our international students might be eligible to opt out or cancel the foreign health insurance. But very, very few cases, right? It is a way we want to ensure that you have this coverage, that you're protected as best as you can while you are studying here in Canada, right? It's really important because everything can be so expensive, right? Your studies are expensive enough. So one reason that would allow you to opt out of the foreign health is if you have MCP. But remember, you're then just getting transferred to the student union plan. So you're still paying insurance through Memorial, just a different one. So you have to remember that having MCP is not enough. It's not going to allow you to have no other insurance, right? You will have to pay for health insurance while you're here. Another reason why you can opt out of the foreign health is if you happen to be studying outside of Canada for that semester, right? So if you're studying at home, kind of remotely, or you're on an exchange or work placement that takes you out of Canada, for example, you can opt out for that semester because you're not here, right, to get the benefits of the foreign health. The foreign health does cover you in sometimes abroad, but not always. So that's why we have that option to opt out. And other eligibility opt out, which really has to do with being a sponsored student with insurance from a Canadian provider. So having just any other insurance doesn't make you eligible to opt out. You have to be one of these specific groups of people with this specific type of health insurance, right? So if you happen to travel to Canada with insurance from your home, it doesn't mean that you can opt out of the foreign health. You have to have it. If you end up obtaining MCP, then as I said, you can consider opting out of the foreign health and switching to the student union plan. However, you don't have to do this. And you really want to, I think, reflect on the differences kind of in the coverage, right? To decide. And in fact, most students in their first semester are not going to be eligible to do this. So generally, you'll have the foreign health for the first semester anyway, and then perhaps in the next semester or at the start of the next academic year in the fall, you may have the option because we do have opt-outs every semester. So to be eligible to opt out having MCP, you have to be a full-time student, and the MCP you have has to be valid on or before January 1st, valid beyond January 21st, and subject to renewal. Okay. And that criteria will kind of change every semester. We basically need to see that you have the MCP coverage valid from at least the start of what would have been your foreign health coverage, which will come into effect on January 1. Okay. And we also need to see that you have it, at least that you can renew your MCP. And the reason why most students in their first semester are not going to be able to opt out is because most won't meet the criteria to have that MCP issued on or before January 1, because your semester doesn't begin until a little bit later and you might not arrive in Canada until after that. So they won't give you MCP earlier than the date you arrive in Canada, and sometimes like close to when your studies in Canada will begin. Okay. Um, and the way our opt-outs are managed is that you'll get an email from GuardMe basically beginning in about mid-December, and those emails will go out as students then register for the winter semester. An email from GuardMe saying, welcome, you will be enrolled in your plan at your institution. However, you might be able to opt out if you meet this criteria or this criteria. The deadline is this date, go to this website. So opt-outs are done online, and you can't opt out until you get notified by GuardMe that they're accepting the opt-outs, right? Because we only send those emails to students who are registered, and we only do it so far in advance of the winter semester beginning, which will be about in a couple of weeks in mid-December. And the deadline is January 21st, 2025. Okay. So if you end up coming and have the MCP valid on or before January 1st, and you're a full-time student, you may wish to opt out and switch to the student union plan. You do it online, and the deadline is January 21st, 2025. Okay. Another reason why you may be eligible to opt out is if you're outside of Canada, right? So if you're registered, we're still going to automatically trigger that charge. But if you're registered and you're taking online courses outside of Canada, for example, then you can opt out. You would need to do this before the deadline, January 21st, 2025. It's also done online. It's just your reason to opt out is different. And this opt out really only cancels you for the one semester. So every semester you're studying outside of Canada, you would need to opt out. And the other eligibility, as I mentioned, is if you are a sponsored student from a scholarship program that's managed in Canada for Libyan scholars, or if you are, in addition to being an international student, a refugee claimant, and you have the interim federal health care plan with the government of Canada. right? But outside of that, we would not accept any other health insurance as a means to opt out. And those students would have to attest to having this insurance, also opt out online, also before the deadline. So wait to get that email from GuardMe. Okay. So let's go into another quick quiz, again, just to kind of reflect on some of the additional information that was presented and see. So the first question here, is it true or false? Having MCP is adequate health insurance. Yeah. So from Memorial's perspective, it's false, right? And in fact, most individuals who live in Canada who have the provincial public health insurance, if they can afford it, will have additional insurance. And many will get it through their employers or their educational institutions. Others, if they're not working or are self-employed, can purchase it, and really, should if they have the funds, right, to do it. So from Memorial's perspective, no, having MCP is adequate health insurance. And this, I didn't change this question. I can opt out of the foreign health insurance in February. Is that true or false? That one's false. Yep. The deadline is January 21st. All right. And 3, I have insurance for my home country, which means I can opt out of the foreign health. Is that true or false? False. Perfect. Thank you guys so much for engaging. So I think we're hopefully simplifying it a little bit. Health insurance can be quite complicated, but now we're going to kind of move on. I wanted to add the slide in case there are any students here who will have their family members who may be accompanying them to Canada. And when we use the term family members, we're referring to a spouse or perhaps a common law partner, as well as any dependent children. Okay, so that's what we mean by family members, usually people who are dependent on you and they're coming to Canada to accompany you as you're a student here. So as I've talked about, if you have a spouse or children and they have an immigration document valid for at least a year, they can also apply for MCP and get MCP along with your application. If you get MCP and you switch to the student union plan and your family, your dependents have MCP, you can choose to add your dependents into your student union plan. You can follow their process and do it, right? Because all this insurance we're talking about extends just to you, the student. The fee you're paying in your student account is for you. If you have accompanying family members and you want to get this insurance for them, it is extra, right? You would have to opt them in, so you have to take action, and then you have to pay additional, okay? If you end up staying in the GuardMe insurance, similarly, you can purchase more insurance from GuardMe to cover your dependents. And you have generally 10 days from when you get your healthcare access card from GuardMe to be able to add your dependents so that their coverage goes retroactive to January 1. And you do that online at the guardme.mun/mun website. So you pay GuardMe directly, right? You pay your insurance fee to the university as part of all your tuition and charges. But if you have to opt in because you're not registered or opt in your dependents, it is an additional cost that's done through the guardme.mun kind of website. And one thing we didn't cover is when will you get your healthcare access card, right? So what we do with the foreign health insurance is you will be kind of pre-enrolled in the plan beginning in a couple of weeks in about mid-December, whereby you'll get that email from GuardMe to say, welcome, you may be added, but here you can opt out or whatnot. And the deadline is January 21. January 21 is also the deadline to add and drop your courses at Memorial. Okay, so we wait until January 21st to see who is still in the plan. So who has stayed a registered student at Memorial and who hasn't opted out. And then for those students who are still registered and have not opted out, we then go to finalize your enrollment. So we pre-enroll you so you have the opportunity to opt out. And then if you stay registered and don't opt out, we finalize that enrollment. But that's done at the end of January, right? Once that enrollment is finalized, you get then a second email from GuardMe. if you stay in the plan. And that email has your healthcare access card. So when we're talking about adding your dependents, it's 10 days from that time to be able to add them and get the coverage retroactive till January 1. So you have the coverage from January 1 for yourself, but you won't actually get your healthcare access card until after towards the end of January, early February, when our deadline to opt out is over. Okay. Now, there can be another scenario for your dependents, which is whereby you might have MCP, but your dependents might not get MCP. And that could be because they have a shorter immigration document and aren't eligible. And that could also be due to the fact that they might arrive later on, like perhaps your plan is to come first and your family to come later. So it can happen that we have students here where the student has MCP, but their spouse or child doesn't. And so for those individuals, they can still purchase a policy from GuardMe. It's just a bit of a different policy and it can't be backdated to January 1. Okay. So it's just to say that if you have family members with you, it's also very important to take care of their health care needs, right? Particularly children, they get sick often being exposed to lots of germs and coming to a new environment, right? You may notice that people fall ill, as they start to acclimatize to this new area. So there are options, but it will be additional to add your family. Okay. So we're going to move on now to GuardMe, which is the provider of the foreign health insurance. There's many services that are available for you as a student. So once you get your healthcare access card, you will be able to create an online account with GuardMe. And this is where you can maybe make a claim to GuardMe, or you can review your policy, download your healthcare access card. Once you get your healthcare access card from your online account or through that email, you should have a copy with you. And anytime you seek medical services, you can present that card. That the provider of the medical services may be able to then bill GuardMe directly. So you won't have to pay for the service. They'll just submit a claim to GuardMe. But there are times where that can't happen because the medical provider might not be able to do that. And so if you ever had to pay for a service, you would pay for it and then get a receipt, and you would go online to submit and upload a copy of the receipt to make a claim so that GuardMe then reimburses you, pays you back, right? Provided again that expense is something that's covered in the policy. Okay. So there is their online account. GuardMe also has this program. So this is kind of the GuardMe account login. And GuardMe also has a program called Mobile Doctor. So this would only be available, of course, these two services, if you stayed enrolled in the GuardMe plan. So there are many different ways, or there are a few different ways which we'll go over in terms of how to access healthcare, right? When you're here, if you're not feeling well. But it can be challenging to get an appointment to speak to a doctor. And that is because healthcare in Canada certainly is going through a crisis. There is a shortage of doctors, there's a shortage of nurses. Okay, so there are challenges in accessing healthcare. So a great option is to be able to meet with a doctor kind of virtually, and that's what Mobile Doctor is. So if you have a GuardMe plan, then you can, with your healthcare access card number, register with the Mobile Doctor site, book an appointment, speak to a doctor virtually, and the cost of that is entirely covered by GuardMe. All right. They can even write prescriptions, right, and diagnose certain things, and send a prescription, to your chosen pharmacy that might be near you, right? So it is a great option to seek medical care. GuardMe also has another program called Keep Me Safe, or now it's also called the Student Support Program. This is different than Mobile Doctor, and that Mobile Doctor is generally kind of for those physical health concerns. Keep Me Safe, for the Student Support Program, is about your mental health and wellness. All right. So it connects you with a counselor. And there are different ways that you can be connected with a counselor. There's an app you download basically, and you can chat to a counselor. You can have a virtual appointment or a telephone call with a counselor. They can also, if you wanted an in-person one, put a referral in to book a counseling appointment for you in person. The great thing about the student support program and the access to a counselor is that it's 24 hours a day, 7 days a week. So even when like the MUN counseling office is closed, this is an additional support. They can also speak to you in many, many languages. You can use it when you're not in Canada and get connected. And they also try to match you to culturally appropriate counselors as well. Okay, so this is a free service and it's actually available to all students of Memorial. You don't have to be staying in the GuardMe program. Okay. GuardMe also has campus ambassadors. So while you're here at Memorial, you may see them around and they're there to help answer your questions, about GuardMe and the insurance. And after you've been here, if you wanted to volunteer, it's also a great opportunity to work and make connections with a national organization such as GuardMe. Okay, so those are some of the services with GuardMe, your online account where you can make claims online, the mobile doctor where you can meet with the doctor, as well as the Keep Me Safe and the campus ambassadors. So just another quiz here to kind of check in. Let me know if you think this is true or false. 1, to make a claim, I can only do so by mail. Okay. Yep, that's right. It's false. It's online. And 2, with GuardMe insurance, I can only see a doctor virtually. Is that true or false? That's right. It's false. So it will cover the cost to see other doctors. It's just the mobile doctor is an additional option through GuardMe. And 3, I need to be enrolled in the GuardMe insurance to avail of the Keep Me Safe, that student support counseling program. That's also false. Yeah. So that's available actually to all students of Memorial. Okay. All right, so now we're going to kind of move on to talk about ways in terms of seeking healthcare. All right, so if you're not feeling well here while you're in Canada, what do you need to do to seek and see a doctor? So in Canada, we have, of course, your primary care physician as well as specialist physicians. A primary care physician is also called a general practitioner and is more commonly referred to as a family doctor. So the way the healthcare system in Canada works is that most everybody, if they can, will have a primary care physician or a family doctor. That would be their first point of contact to speak if they weren't feeling well, is they would talk to that physician. That family doctor can often diagnose, prescribe, and treat you for whatever is going on. But sometimes they may say, this requires more specialized care. So they would put in a referral to a specialist. So a specialist, specializing in a certain area of medicine, like oncology for cancer, dermatology for skin conditions, neurology for the nervous system, respirology. There's all kinds of specialists. So it's not possible in Canada to book an appointment directly with a specialist. So even if you say, oh, I'm asthmatic, I really need to see a respirologist, you can't just go find one and make the appointment. The only way to access a specialist is through a referral from a primary care physician or family doctor. Okay, so that's one way that the Canadian healthcare system may differ, perhaps, to how healthcare is managed in your country of residence. And these are physicians, right? So they're medically trained doctors. Outside of physicians, there are other types of medical services. So, a dentist is certainly a doctor, but not what we would call a physician, right? Or a medical doctor. An optometrist or ophthalmologist that specialized, in the eyes. They're not, they are doctors as well, and they are specialists that you can see directly, right? So they're not uh, medical. We would classify them as kind of other medical services. And other medical services whereby you might not be a doctor, for example, like you could be a physiotherapist or chiropractor or that sort of thing. Those paramedical and other medical services like optometrists, dentists, you can book an appointment directly with those people, right? And there's not a shortage of those in the area. So, if you had dental insurance coverage or you wanted to pay for it, you could just look up the different dental offices that are around your area. You could contact them and say, are you accepting, new patients? And you generally wouldn't have difficulty in kind of accessing those clinics to get a new patient, similar to like massage therapy or physiotherapy, right? A lot of people won't see those folks unless they're referred by a physician, but it's not so difficult necessarily to get into those. It's more so a challenge here in Canada currently with the shortage of doctors and family doctors specifically to get to see like a medical doctor. Now, it's difficult news, of course, for a lot of people, but you're very fortunate in being a student at Memorial in that you have the Student Wellness and Counseling Center that is located on campus. And the Student Wellness and Counseling Center is staffed by several primary care physicians or family doctors. There's also counselors there as well, and there are nurses that are there as well. So generally, most individuals would see a doctor kind of first of all, but there are situations where a nurse, as well as a pharmacist in some cases, can actually write prescriptions and diagnose kind of more, I guess, smaller kind of health concerns. Okay. So if you're not feeling well, you can see a doctor at the Student Wellness and Counseling Center. But depending on the issue, keep in mind that you might be able to also make an appointment with a nurse at the Student Wellness and Counseling Center, or you might be able to visit your local pharmacy and talk to your pharmacist. So, for example, pharmacists can treat like and give prescription medication if you have a cold sore, if you have a urinary tract infection, and things like that. Okay. But because you're a student at Memorial, you do have access to the Student Wellness and Counseling Center, so you can book an appointment there to see a physician. Outside of the Student Wellness and Counseling Center, there are external clinics, right? So there are primary care physicians or family doctors that set up their own clinics. Most of these clinics don't like accept new patients, right? They have a patient base already. So it can be hard to see a doctor kind of outside of the university setting. Because it is a concern here in Canada and in the province of Newfoundland and Labrador, there are some clinics that are set up whereby if you don't have a family doctor, you can access or do kind of walk-in clinics, right? But you do essentially have a family doctor clinic, so that's good. There's also the emergency department because, of course, the Student Wellness and Counseling Center is only open, during the weekdays at certain hours. They do have drop-in clinics sometimes, but most times you have to call and kind of make an appointment. So what happens if you fall ill kind of outside of these clinic hours or you can't get a doctor's appointment kind of soon enough? There are emergency departments. Now, really, they should be reserved for, if you have to see somebody right now. So obviously, if you're having kind of chest pain and you're quite concerned, or you break a bone or that sort of thing where you may need treatment, you go to the emergency department. When you go to the emergency department, it's not first come, first serve. So it's not like a drop-in clinic. You are triaged. So meaning, the most serious cases are kind of taken first. So you could be waiting depending on your situation for a long time. And has been a problem because many people in the province might not have a family doctor, that they might go to the emergency room just for kind of, things that if they could have seen a family doctor, they would have, right? So sometimes they can be quite overrun, but they are there. And so if it is an emergency, right, you should do that. I don't want to discourage anybody who's in a true medical emergency from using the emergency department. So you have to use your own judgment. You know your health, you know what's normal for you, and you should go. If you're onshore, there is a health line here in Newfoundland and Labrador that's accessible 24 hours a day, right? I'm not going to be the one, Hareem's not going to be the one to say, yeah, you can wait to see a doctor, or no, you should go to the emergency room. But trained health professionals at the health line, where you can get connected to a registered nurse, can do that for you, right? So I've often called the health line, particularly if my child is unwell and I'm curious, to get some advice from a nurse. And sometimes I'll be told, yeah, make sure they see their family doctor in the next few days, or, I recommend visiting your local emergency department, right? So there is that health line to get that advice that is there. Okay. Um, so despite, sometimes it being hard to access healthcare, you are very fortunate that you have the Student Wellness and Counseling Center. I strongly recommend you visit their website, off the MUN website, to get familiar with their services. It's not just physician. They do have nurses, they do have counselors, and lots of different supports there, and they're available for you and your family as well, okay, if you're a student here at Memorial. Okay. All right. Last quiz, I think, and then we get to move into some questions. So, true or false? It is easy to get a family doctor outside of the university. Yeah, it's false. I wonder if how clear I made that point, because, we say in terms of the healthcare crisis in Canada, and it's real, it's true. We don't want to make light of it. We want to set up, those expectations, but that's why, I mean, the Student Wellness and Counseling Center is so wonderful, right? There are a lot of people not part of the university that can't get those appointments. And two, I can directly make an appointment with a specialist. Is that true or false? False. Perfect. Okay. Um, so that was really kind of it in terms of the presentation. I hope it gives you an idea of what health insurance is, what the different types of health insurance are. You want to be knowledgeable that, like, not every insurance is going to cover everything 100% of the time. Navigating the healthcare system can certainly be challenging, and we do hope that you remain healthy and you have the health insurance and you never have to use it. I mean, that'd be awesome. But we're here if you have any of those questions. So I think, Kareem, we can probably stop the recording and get into the Q&A.